Hello, my name is Kristina Tamanaha,
And my name is Martin Gutierrez.
and this presentation is about floating with safety and confidence.
Floating is defined as work on a unit to which the employee is not permanently assigned. In this case, we are talking about the floating nurse.
We believe that it is important to establish guidelines for managing the use of float nurses when planned staffing is inadequate due to patient census, acuity, unit activity, or unplanned leave. When necessary, employees shall be expected to float or accept any reasonable assignment within the designated unit.
First of all, the concept of a floating nurse is not new. However, there are two current issues affecting the established system. For instance, the shortages of nursing staff due to the budget crisis and our current financial economic problems. As a result, more and more nurses are being floated to areas to which they are not familiar with, which then increases the risk of inadequate nursing care. We do not disagree with floating. We actually encourage it. And we are here to share guidelines that can make floating a better experience for both nurse and the patient.
According to the California Code of Regulations, sections 1443.5, the Standards of Competent Performance, produced by the Board of Registered Nurses, a registered nurse shall be considered to be competent when he or she consistently demonstrates the ability to transfer scientific knowledge from social, biological, and physical sciences in applying the nursing process as follows.
Formulates a nursing diagnosis through observation of the client's physical condition and behavior, and through interpretation of information obtained from the client and others, including the health team.
Formulates a care plan in collaboration with the client, which ensures that direct and indirect nursing care services provide for the client's safety, comfort, hygiene, and protection.
Perform skills essential to the kind of nursing action to be taken.
Delegates tasks to subordinates based on legal scopes of practice of the subordinates and on preparation and capability needed in the tasks to be delegated.
Evaluates the effectiveness of care plan through observation of the client's physical condition and behavior, signs and symptoms, reactions to treatment through communication with the client and health team members.
And lastly, acts as the client's advocate.
Furthermore, the Board of Registered Nursing has produced an advisory statement on floating for nurses. The document reminds nurses of their floating responsibilities, in which the RN is always responsible for providing safe, competent nursing care. RN also must have the necessary knowledge, judgment, skills, and ability to provide the required care.
It is also the nurse's responsibility to determine whether he or she is clinically competent to perform the nursing care required on the new unit or with the new patient population. If the RN is not clinically competent to perform the care, he or she should not accept the patient care assignment.
Also, the article again restates the importance of standards of competency performance, which we discussed on a previous slide. And as for nursing staff responsibilities, it is a complete collaboration of the whole nursing team.
Basically, no man is an island concerning safe, adequate, and confident health care.
What exactly are the fears of a floating nurse? Well, first and foremost, the potential negligence of proper care with patients' needs and technological skills. Will the float nurse have help? Will there be resources available for immediate assistance?
The realistic fear of the float nurse is that if a patient's condition deteriorates, he or she will lack the necessary skill or knowledge to recognize and respond to it. The problem is compounded by the fact that specialized units often have policies and protocols not known to the general nurse. The nurse may be fearful, worried that he or she will miss some small signal of a change in the patient's condition.
Also, no nurse wants to be put in a position in which they may feel helpless and overwhelmed.
Furthermore, no nurse wants to jeopardize their career, their patient's safety, and even more so, the patient's life.
So how do you make a floating nurse feel confident to provide safe and adequate patient care? Here are some interventions.
Education builds confidence. We need to educate the nurses about specific unit policies, procedures, and protocols.
We need to give a floating nurse full and proper tours of the unit so the nurse can provide efficient patient care. And by knowing the ins and outs of the unit, the nurse may feel comfortable and confident.
The nurse needs to be properly educated on the unit's specific technological skills to provide adequate patient care.
The floating nurse needs to be strictly educated on the unit's specific medications so no med errors can be done.
Equipment may be different on each unit, therefore education should be implemented on how to use each unit's specific device. When floating between units occur, there should be a systematic plan for cross-training of staff to ensure competency.
Here are the responsibilities of a nursing unit staff. For supervisors, they assess the need for the type of staff to be floated. They ensure unit staffing needs are met prior to the deployment of nurse to another unit.
Concerning nurse managers, they assess and communicate 24-hour staffing needs and ensure that each shift has adequate staffing. They assess the need for type of staff to be floated, oversee float assignments, orientate charge nurses in planning assignments for floats, and assure that patient care assignment that is fair.
With charge nurses, they orient first-time float staff to the units using the unit-specific float checklist. They communicate with the float nurse. They plan patient care assignments that is fair. They assign a research person to the float staff.
And finally, nursing staff. They will inform the charge nurse, nurse manager, or supervisor immediately if there are any questions regarding their assignment. As a nursing staff, we need to give each other a helping hand, especially to the float nurse.
And with that in mind, through education, training, and teamwork, endless positive results will always come our way. There will always be the need of a floating nurse.
And with these guidelines being followed and correctly implemented,
A nurse can float to a unit
with safety,
and confidence.
and we would especially like to thank our assistants, the lovely Rio Gutierrez,
And Justin. And thank you, sexy nursing students, for taking sexy pictures.
James Agatep,
Jeremy Arcaria,
Debbie Bonwello,
Angela Carolino,
Elena Cortez,
Naj,
Genevieve Falscon,
Chi-Chi,
Steffi,
Robert Stanley,
Karen Tinio,
and Blia Yang. And a special thanks to Dr. Stoner for letting us take pictures in the nursing lab. Thank you. The end.